Hello, my name is Heather Johnson, and I am here to appeal to you on the importance of sterile processing and the reduction of healthcare acquired conditions due to surgical site infections. Healthcare acquired conditions are an ongoing issue in the American medical centers. There have been initiatives to reduce these infections. The most significant is the changes to Medicare/Medicaid payments. Hospital-acquired conditions. The Hospital Acquired Conditions Reduction Program, or HAC, provides an incentive for hospitals to reduce hospital-acquired conditions. Effective beginning fiscal year 2015, the Hospital Required Condition Reduction Program requires the Secretary of the Department of Health and Human Services to adjust payments to applicable hospitals that rank in the worst performing hospitals with respect to risk-adjusted hospital-acquired condition quality measures. These hospitals will have their payments reduced to 99% of what would otherwise have been paid. Policies like this make a difference in the reduction of healthcare acquired infections. However, more needs to be done. Conditions. Healthcare acquired conditions can include infections that patients acquire during the course of receiving treatment for other conditions within a healthcare setting. For instance, if your loved one entered the local hospital due to a broken leg, and during their time in the hospital, they get pneumonia. The pneumonia would be considered a hospital-acquired infection. Infections such as these conditions and even death. Preventing them must be a priority for all of us. According to the Centers of Disease Control and Prevention, on any given day, about 1 in 25 hospital patients has at least one healthcare-associated infection. These infections can come from many different sources. Examples are from a central line, or lack of hand washing, or urinary tract infection with catheter use. The focus of our policy is to reduce surgical site infections. A surgical site infection is an infection that occurs after surgery on the part of the body where the surgery took place. Surgical site infections can sometimes be superficial infections involving the skin only. Other surgical site infections are more severe and can involve tissues under the skin, the organs, or implanted material. To reduce these infections, we propose that more emphasis be placed on the surgical instrumentation used. Even though there are guidelines for the cleaning and sterilization of surgical instrumentation, those who are performing these tasks are not required to be certified. We feel this must change. The occupation of sterile processing must be considered a priority for the reduction of surgical site infections. Medical centers across our state would be affected in a positive manner. We recommend utilizing current certification organizations to make those who are currently in the sterile processing field need to be certified within 2 years of enacting this policy. Those who wish to enter the field will need to be certified within 2 years of hiring. Also, a regular educational update to make sure the personnel are up to date on all necessary education. Raising the level of education within the sterile processing department will benefit not only those specific individuals within the department as a whole, and the facility, but also the patients whom the instrumentation will be used on. Sterile processing is the first link in the infection prevention chain. Improperly cleaned, disinfected, and sterilized instrumentation can introduce pathogens into the operating room, increasing the risk of surgical site infections. Reducing the risk of infections is of paramount importance in the healthcare industry, both for the patients and the employees. For surgical equipment, diligence must be taken by sterile processing department's technicians in the proper care, handling, and reprocessing. When a facility's employees are sterile processing certified, it helps to ensure that the sterile processing technicians are properly educated on sterile processing techniques and best demonstrated industry practices. Healthcare facilities must meet strict guidelines when it comes to sterilization and cleanliness. When employees are properly trained and certified, the facility is better able to serve its patients and provide the best care possible. Sterile processing certification offers several benefits. First, it validates the employee education base within a facility's sterile processing department and provides a solid foundation for which to build training processes. Secondly, certification offers sound motivation for technicians to receive updated recommendations and research through stringent continuing education requirements. Lastly, it validates an understanding of protocol adherence and reinforces best practices surrounding surgical instrument reprocessing. Sterile processing techs who work behind the scenes to perform critical functions in infection control and support delivery must be properly educated so that they can provide excellent care and patient safety in today's modern medical facilities and hospitals. Education is required for most patient care positions. Sterile processing should be no different. Thank you